Kenya has used 84 billion shillings so far in the fight against the COVID-19 pandemic. Treasury Cabinet Secretary Ukur Yattani says the amount has been already disbursed to fund various initiatives aimed at keeping the pandemic in check. Now, the Ministry of Health and counties have absorbed the lion's share of the funds. The 84 billion shillings is part of a 134 billion shilling kitty the country has to fight the pandemic, which has so far claimed 460 Kenyans, 4 of them in the last 24 hours, with 28,754 cases confirmed. Elphas Lagat reports that 650 of them were cases confirmed in the last 24 hours.
Questions have often cropped up on how Kenya has utilized billions of shillings that authorities have managed to marshal from donors and lenders 5 months since the outbreak of the COVID-19 pandemic.
It was a very important question.
The National Assembly's Health Committee is seeking answers on how COVID-19 funds have been used.
If we report that we have 134, you'll tell us the correct figure. Is that where has this money gone? That's a big question with the Kenyans.
Treasury Cabinet Secretary Ukur Yattani put to task by the legislators.
We know how much has gone for Kazi Mutahani, how much has gone to vulnerable groups in buying food. Kenyans are asking. There is too much money that has been released by the government, but we are seeing too little.
He pointed out that the country has received 134 billion shillings, of which 84 billion has been utilized. Of the monies disbursed is 10.2 billion shillings, which was sent to the Ministry of Health, 9.7 billion from Government of Kenya, and $500 million from the Royal Danish Embassy, Danida.
It will definitely be ungodly if money meant for this particular challenge is diverted or used for something else that does not add value to the well-being of our people. But I'm not competent to say that, and neither do I have any proof.
Yattani further detailing that 5 billion shillings has been sent out to county governments through the Equitable Revenue Share formula for purposes of urgent COVID-19 response by acquiring the necessary health infrastructure. A further 2.4 billion shillings, basing on the Salaries and Remuneration Commission recommendation, sent out to supplement allowances for frontline healthcare workers.
We are working very hard to cushion the economy. That's why we came up with the first layer of stimulus package, second layer, and will not also rule out the third layer of further stimulus, because this is a disease that's going to not only affect health, but is also going to ravage our economy.
Parliament, on the other hand, ring-fenced 1.5 billion shillings to support specific hospitals in the face of surging COVID-19 numbers, with vulnerable groups in 4 counties getting 850 million shillings. Of the 502 million shillings from Danida, the Ministry of Health received 350 million shillings, as the Water Services Trust bagged 152 million shillings. 650 people from a sample of 6,768 tested positive today, taking the tally to 28,754. Today's positivity rate at 9.6%. The death toll rose to 460 after 4 patients succumbed within the same period. Recoveries now stand at 15,100 after 490 patients were discharged. It's now 5 months since the outbreak of the pandemic, and the curve is still elusive. Personal responsibility, however, remains of utmost importance in the fight against COVID-19. Elphas Lagat, Citizen TV, Nairobi.